Hey guys, so today I thought I'd do a follow-up video to my alcohol withdrawal video and talk about some of the medications that help with the symptoms that I was describing in the previous video. Obviously, as I said in the previous video, alcohol withdrawal is very serious. It's life-threatening in some cases, but medical management can be used to avoid complications in withdrawal, such as seizures or delirium tremens, the DTs. So, the first common group of drugs used are called benzodiazepines. These are the most commonly used drugs. And they include diazepam, lorazepam, and a drug called Librium. Who's the real name for Librium? It's a tricky one. It's something like chlordiazepoxide, something like that. Sorry if I've butchered that, but that's Librium, and that's the one I had when I was in rehab, and when I did my home detoxes too. I did 2 home detoxes with the Librium. So 2 home detoxes and 2 inpatient detoxes I have. Now these are given to help prevent seizures and to calm the central nervous system, because as previously discussed, alcohol withdrawal often leads to hyperactivity in the brain and overexcitation of the nervous system. So these drugs help to calm everything, bring everything down. They work on the GABA receptors just the same as alcohol. And when you stop alcohol, obviously the GABA receptors are empty and the glutamate shoots up. So you want to start off with a high dose of Librium to calm the brain, and then you wean off of it over a period of a week, 2 weeks, depending on your starter dose, until you're weaned off the Librium. You can do it precisely with the proper dosage needed with the tablets, so it's a lot safer to do it that way. In other cases, anticonvulsants can be used. Now these are obviously given to people that are severely deep into alcohol withdrawal and are having seizures, and also where benzodiazepines may not be ideal for the patient. So as the name suggests, they help reduce seizure risk and they help with irritability and anxiety. Thirdly, there's beta blockers or alpha-2 agonists. Medicines like propranolol, clonidine, and they help manage elevated blood pressure, rapid heart rates and tremors, though they don't address the risk of seizures directly. The next one is one I am very used to, and that's thiamine, vitamin B1. Now this is given to you in a big, thick injection of yellow fluid. It's a big needle, lots of yellow fluid, and it goes in your bum. And it's quite painful, it's quite a shock, but it's very, very good for you. Now I've since learned that this is essential to help prevent something called Wernicke's encephalopathy, which is a serious neurological condition, and it occurs during withdrawal. Also, chronic alcohol use completely depletes thiamine levels. So this injection, I think it was called Pablanax, something like that. But yeah, very good for you when you're withdrawing. Now I've not heard this personally, but I've read that antipsychotics can sometimes be used if the person is experiencing hallucinations or agitation, but they're definitely not the first line. I've never heard of them being given in my time in detox. They don't help prevent seizures and stuff. So I guess they're just there to help if a person is having hallucinations or experiencing psychotic effects. So, as would be expected, medical supervision is critical, especially in moderate to severe cases of alcohol withdrawal, and also getting the correct dosages and, making sure you're taking the right medications. So that was a brief explanation of some of the medication given in alcohol withdrawal. As I said, my experience was mainly Librium and the vitamin thiamine, big injection in the bum. I had that a couple of times, as that was 2 inpatient detoxes, and the Librium I had quite a few times, as I failed quite a lot in my efforts to quit alcohol. So anyway, thanks for listening. I'll speak again soon.